Phase 3. Professional Judgment. It's good to let the caregiver and patient see that you are using the visit structure template to help ensure and build confidence that important things are not overlooked or missed. People like to know there is a process. Use professional judgment to address what you are capable of addressing, as communicated previously. If you are unable to satisfactorily fulfill an expectation, inform the patient or caregiver about your attempt and the best course based on what you know. "I don't know, but I will find out and get back with you" is a good, honest, and the only answer when you don't know. Teach rather than do, if possible. This empowers the bereaved and leads to a more satisfactory experience, as it lessens unnecessary clinician dependency and suffering from anxiety issues. Provide a bereavement quick guide that helps patients understand within minutes what to expect regarding their feelings and the journey they'll find themselves on. Addressing pain. By this time, patients and caregivers are familiar with our hospice's 10-point scale. Ask the patient and/or caregiver to rank their pain using the scale and include it in your documentation. As mentioned previously, it is estimated that as much as 80% of pain is psychosocial in nature. This is where the bereavement expert has great opportunities to fulfill a critical part of the hospice mission. Our hospice does not minimize the critically important foundational role of the bereavement function. In fact, at our hospice, it's much more than a counseling service. We have a vast array of powerful tools that go far beyond traditional bereavement approaches. By offering more than counseling services, our hospice bereavement experts have more opportunities to create trust and earn the right of relationship in order for counseling to be more effective. Often, many patients and caregivers do not even realize the need for professional bereavement care, as it so often is after the transition that the true immensity of the loss is realized. Use the hospice menu to teach, pointing out the options of care including HemiSync, EMDR, IADC, dream exploration, discussions of spiritual experiences, breath work, meditation, and other proven techniques for relaxation that facilitate direct experience. Keep in mind that these products and services can be used for both patients as well as caregivers prior to the patient's passing or in the anticipatory stages. They can be especially effective if an individual has fear of physical death. Many comforting experiences for the bereaved seem to come from activities where both right and left brain functions are heightened, such as HemiSync, EMDR, IADC, meditation, and the REM state of sleep. Using the hospice menu, point out that our hospice can provide HemiSync devices such as CD and MP3 players, as well as specially designed sleep sonic pillows that help people relax and even have experiences that make counseling efforts dramatically more effective. Many top grief and PTS experts explain that traditional counseling is often equivalent to trying to put out a house on fire with a squirt gun, often re-traumatizing patients as they relive their situation during a counseling session. You cannot think yourself out of grief. What has proven to provide effective reduction and even resolution of grief and PTS disorders is the replacement of an experience with an experience. It is through direct personal experience that grieving people find immense and often even life-altering comfort. This is why the use of these types of products or treatment techniques are so important to our hospice. In fact, this concept was recognized by Elizabeth Kubler-Ross, a pioneer in the hospice movement. During the later years of her career, she worked with Monroe Products, developers of HemiSync, a scientifically and clinically proven audio guidance technology with over 50 years of research, to create sonic products specifically designed to help patients and loved ones relax, achieve better states of mind, reduce pain, and dramatically reduce fear of physical death. Whether these are real or synthetic experiences seems to make little difference in the grief resolution effect, as the power of the experiences have such a dramatic impact. Using the hospice menu, point out that EMDR, eye movement desensitization, has also been useful for many people in grief and with PTS issues. This technique requires training, but it has been proven to be highly effective in reducing suffering. At this point in the grieving person's journey, the hospice should also be very aware of religious belief systems. Always be respectful and non-judgmental. Do not try to convert people to a particular view. To use a grieving person's pain to sell a particular ideology is one of the most disrespectful things a hospice bereavement expert can do. We offer tools, not belief systems. Offer a journal for the bereaved. Suggest that the bereaved write a letter to their loved one. Talk to the family about other resources that could benefit the patient and family. Use your professional judgment, but do not assume that your listeners completely understand what you communicate, as they can become overwhelmed with information. Listen carefully and suggest thoughtfully. If appropriate, point out that near-death experiences offer a quite impressive hope of what we experience when we pass. The near-death research studies offer considerable hope for the bereaved. One of the most powerful opportunities for grieving people, especially if they are suffering greatly from the feelings of guilt and shame, is a program from the Monroe Institute called Exploration Essence. This program has greatly reduced and even shut down the negative mental chatter of these absolutely destructive feelings by helping people discover their true nature, allowing them to start living more non-comparative and derivative lives. It should be noted that the word coping is often used by bereavement counselors, which causes great pain for the bereaved, as they feel they will never be okay again. Some even refer to this as a new kind of normal, which is equally disheartening. Realize that there are alternative ways of viewing death, and viewing it positively is an option. Complete resolution is not only possible, but can be obtained. People can transcend. Death is as natural as birth and is an integral part of our development. Phase 4. Documentation. Let the patient see your computer. Document, explaining the use of your computer, especially with your first few visits. I'm going to write some of my notes in my computer so we can coordinate our care. These help us so much. This builds confidence with the patient and caregiver. They like to know that the hospice is organized. It is important that documentation is done during the visit while the details of your visit are fresh in your mind. We all know how busy life can be, and it's difficult to remember things later on, especially if you're tired. Document at the time of your visit. We use an electronic medical chart to document your needs and concerns so you can have confidence that all team members will have your information. So even if you call us in the middle of the night, you don't have to retell your story over and over. We know and can focus on the concern. Phase 5. Build confidence. Recap what you have done. As a teacher, explain what you have done as well as what you didn't or couldn't do. Great teachers always review. Question. Do you have any questions or concerns I have not addressed? Listen, listen, listen. Boost assurance and confidence. You are on a journey. It's your journey as well as a journey for your loved one. We will support you in any way that we know. Know there are options. I think you are going through the normal grieving process, but it's your schedule and not to be set by anyone else. Sometimes well-meaning people think that you should get over it within a few weeks. This worldly opinion of death is quite unfair. Know that many people will see you, quote, acting normal and presume that you must be okay, when in fact you are suffering greatly. Use the tools and contact us if you have needs, regardless of when, whether it is months or even years down the road. We're here to help, always. If there are areas a caregiver could improve, you might say it like this. You're doing a great job. To make it even better, do X and Y. Our hospice's contact information is on the sticker on your phone, on the pill box, on a magnet on the refrigerator, and on all of our documents, such as the quick guides. When speaking about hospice, always refer specifically to your hospice, never just hospice. Educate the bereaved that not all hospices are the same. We have a very intentional way of ensuring care so that important things, as well as small things, are not overlooked, and that our hospice has vastly more options for bereavement than a typical hospice. We are creating an experience. Phase 6. Post-visit. Communicate with other team members if needed while the specifics of your visit are fresh in your mind. Contact resources that the bereaved need as soon as practical. No-nos. Never give out your personal cell phone or contact information. Never give the impression to anyone that we are too busy to take patients. A hospice can give decades of great service, and this message will stick in people's minds for years. There is always room at the inn. No words and phrases. Continuous care. Instead, use crisis care so we do not create an expectation we cannot fulfill. After hours or on call. Instead, just tell the caregiver and patient that they can always call. We are a 24/7 hospice. We have only one chance to do it right. There are no redos in hospice. So let's make the world a brighter place for people that are hurting. Let's help them transcend.